Okay, so we'll give it about one more minute and then we'll go ahead and get started. Okay, 10:35, so we're going to go ahead and get started. Welcome to hashtag Helping Sinlaw Live. This is our first show starting out our series, and we will have this every third Friday of the month from 10:30 to 11:30. Each month is going to feature a new topic, and then shortly after the recording is finished, all of the videos will be uploaded to our hashtag Helping Sinlaw YouTube channel. I will send out that link, but if you want to search it up, go to youtube.com and you can type in the search bar hashtag Helping Sinlaw. Just make sure you put that hashtag mark in there. We have some great speakers and some great topics coming up, so we're looking forward to it. Okay, so today we're going to start out with our smoke-free Alexandria being the first in the state. Okay, so we've got Ashley Stewart who's going to join us first. And Ashley is the Director of Programs for the Rapides Foundation. She's responsible for developing, managing, administering, and assessing the grant-making functions of the Rapides Foundation. Stewart received a Bachelor of Science degree from Louisiana College and a Master of Public Health degree in epidemiology from the University of Alabama in Birmingham. Prior to her affiliation with the Rapides Foundation, she was...
I typically do, but it's probably fine black.
Sorry, just a quick note real quick. Well, hang on. If you're not speaking, please mute. Prior to her affiliation with the Rapides Foundation, she was the Regional Cancer Officer for Central Louisiana AHEC and the Louisiana Cancer Control Partnership, where she was responsible for identifying and implementing best practices in comprehensive cancer control. Let me make a quick note real quick before you get started, Ashley. If you're not speaking, please mute yourself. If you're just getting on, please sign into the chat box your name and if you have an agency affiliation and an email address. And if you have any questions throughout the presentation, go on and put them in the chat. We'll have a section for Q&A at the end and we'll address all of those. So with that, I'll let you go ahead and get started, Miss Ashley.
Hi, good morning, everybody. I'm glad to be here today with Jennifer and Mitzi, who will be presenting following me to talk to you about tobacco prevention and control, and specifically about smoke-free air ordinances and the efforts that have been done here in Central Louisiana. So first, I just want to kind of to start in telling you a little bit about the Rapides Foundation. You can go to the next slide. So the Rapides Foundation, we're a grant-making organization here in Central Louisiana. We serve 9 parishes, and they're here on the slide. We mainly provide grants to nonprofits, municipalities, school districts, post-secondary institutions. Next slide. Our mission is to improve the health status of Central Louisiana, and our vision is to positively impact Central Louisiana by deploying resources to improve key factors of health status. Next slide. So we take a really broad approach to health status. And for us, when we talk about health status, we want people to live longer, free of disabilities. And so we focus on healthy people, which consists of our healthcare access initiative, where we want to increase access to primary, behavioral, and preventative healthcare services. Preventative services, we focus on cancer screenings, medication access, and also address medical manpower issues under healthcare access. The second part of Healthy People is our Healthy Behaviors Initiative, where we focus on 4 behaviors: healthy eating, active living, tobacco prevention and control, and substance and alcohol abuse prevention. Given that there's so much more than to a person's health status than their behaviors and their access, we also spend 40% of our resources on education. And the goal of our education work is to increase the level of educational attainment and achievement for Central Louisiana. And we work all the way from birth all the way to post-secondary. And our final focus area is healthy communities. And under this focus area, we work on economic development with the goal to increase the median household income, and also on the social environment where we work to enhance community and civic engagement and to promote volunteerism. Next slide. So today I'm here to kind of share a little bit of information on how smoking influences on a person's health status. So 42% of deaths in Rapides Parish are from 2 causes: heart disease and cancer. And a lot of research shows that tobacco use increases a person's risk for both of these diseases. So smoking is the leading cause of premature deaths and preventable diseases in the United States. Smoking contributes to 480,000 premature deaths each year. And for an organization that is trying to get people to live longer, free of disease and disability, tobacco is a really main focus of what we do. And we know that 23% of adults in Rapides Parish are current smokers, and this was from 2018. And actually, since this slide was made, there has been some new data that has been released from the Behavioral Risk Factor Surveillance System. And it's from 2019 to 2020, the percentage of Louisiana adults who smoke fell from 22% to 18%. So we are cautiously optimistic about that decrease in the percentage of adults who are smoking in Louisiana. Next slide. So when we look to address tobacco use, it's really important to have a comprehensive tobacco prevention and control program. And there's 4 components that are part of a comprehensive prevention and control program. First, there's prevent initiation of tobacco use, promote tobacco cessation, eliminate exposure to secondhand smoke, and identify and eliminate tobacco-related disparities. And today we're really focusing on that eliminating exposure to secondhand smoke. And we know if all of these components are in place, it improves the health outcomes and reduces healthcare and loss of productivity costs, and it saves lives. Next slide. So when we focus on secondhand smoke, we know that there is no risk-free level of secondhand smoke. Non-smokers exposed to secondhand smoke at home or work increase their risk of developing lung cancer by 20 to 30%. And there's thousands of non-smokers die from heart disease and lung cancer every year because of exposure to secondhand smoke. And the longer the duration and the higher the level of exposure to secondhand smoke, the greater the risk of developing lung cancer. So one of the ways that we address tobacco prevention and control and look at interventions is we look at a health impact pyramid. And so this diagram really shows how interventions impact the whole entire population. So as you move down on the pyramid, you're increasing your population impact. And as you move up on the pyramid, you're increasing individual efforts and needs. At the bottom, you have social economic factors. Then you have changing context to make individuals' default decisions healthier, long-lasting protective interventions, clinical interventions, and counseling and education. And smoke-free air ordinances are a great example of changing the context to make an individual's default decisions healthier. You're increasing the population's impact because it's lower on the pyramid, and it has very little individual effort is needed for it to be successful. Next page. So secondhand smoke policies. So smoke-free policies can reduce the risk of heart disease and lung cancer among non-smokers. Improvements in health outcomes, such as reductions in hospital admissions for heart attacks, begin to be realized shortly after smoke-free policies take effect. And so there are many organizations throughout Louisiana and Central Louisiana that are working towards secondhand smoke-free policies. And go to the next slide. And just wanted to share a picture of a couple of efforts that are being done that fall within that pyramid. We have some that are, working to educate, friends and family, some that are providing smoking cessation services. And what's important to know about comprehensive programs, it doesn't have to be done by one organization, that it can be done as a group collectively, and different organizations focusing on different pieces of those programs. And so with that, I'll turn it back over to Claire.
Thank you, Ashley. Okay, our next speaker is going to be Ms. Jennifer Gilchrist. Jennifer W. Gilchrist, LCSW, is Regional Manager for the Louisiana Campaign for Tobacco-Free Living, a program of the Louisiana Cancer Research Center and the Louisiana Public Health Institute. As TFL Regional Manager for over 14 years, Jennifer has worked with community partners, stakeholders, businesses, medical professionals and institutions, policymakers, governments, and committed volunteers to promote an pure air for all. Jennifer has earned her national certification in tobacco treatment practice and is co-chair for the Central Louisiana Healthy Communities Coalition. She serves as chair of the Central Louisiana Long-Term Recovery Group and is a Rapides Parish DARE board member. She participates in Professional Women's Network, 100 Women Who Care, and is a parishioner of St. Francis Xavier Cathedral Church. She received her Bachelor of Social Work from Loyola New Orleans and her Master of Social Work from Louisiana State University in Baton Rouge. Welcome, Jennifer.
On the ground, right, and everything.
Jennifer, you're muted.
Okay, sorry about that. I was muted. Thank you, Claire, for the introduction. I appreciate that. And of course, so glad to be here with all of our coalition members and guests on the Helping Sinai Live launch. So I want to talk to you about specifically Alexandria smoke-free story. In 2007, the Smoke-Free Air Act was passed by the state of Louisiana. Unfortunately, there were two huge exemptions in coverage, which were freestanding bars and gaming facilities. And so although we had no smoking in most of our public places, such as your grocery stores and your malls and your movie theaters, our freestanding bars and gaming facility employees were not covered. However, they did do a wonderful thing, and they repealed preemption, which allows local municipalities to strengthen the state law at the local level. So this allowed Alexandria or any other community throughout the state to remove those exemptions and strengthen the law. Next slide. So air quality monitoring was conducted when we knew that we had capacity to share the effects of secondhand smoke on the public. We conducted air quality monitoring between January 22nd and February 19th of 2011. Lots of you participated in that. It was a coalition event, and we assessed the impact of environmental tobacco smoke on indoor air quality by measuring indoor air pollution levels in 10 smoking bars and 2 non-smoking bars. This testing was analyzed by Dr. Daniel Harrington, who is Assistant Professor of Environmental and Occupational Health Sciences at LSU Health Sciences Center School of Public Health. And on March 17th, 2011, we had a press conference to release those results. It was breathless in Alexandria, air in local bars, hazardous and harmful for employees. Next slide. So as you can see here on the chart, the first chart is the smoking bars, and it goes way up into the hazardous level. In the middle were the 2 smoke-free bars, and other studies that have done smoke-free, which is in a more acceptable level. And then the right bar is the lowest, and that's outdoor air. And so what we found and what these results showed was that 60% of the bars sampled in the city of Alexandria had air quality levels that were unhealthy, very unhealthy, or hazardous, according to US EPA standards. This means bar employees, musicians, and patrons are being forced to put their health on the line for a paycheck, and patrons for entertainment. So we released these studies, and it clearly showed we have a problem in these venues with people exposed to secondhand smoke and the effects on their health. Next slide. So we began the Equal Air for All campaign. It's not called that anymore. You'll hear me talk about healthier air for all, but at that time, that was the name of our campaign. We had lots of outreach. One of the first things we did was a photo shoot for billboards. And I love this campaign. It was awesome. We had local community leaders, council members. Dr. Holcomb was there. Radio personality, Carlette's on there. You can see her. Gary Perkins, who's one of our community members with economic development. And we did this fantastic photo shoot. And then these went up to be the faces of the campaign. And they were people that you knew. It's people that you talked to. It's people that you work with. It's people that you see out at the grocery store. So it meant a lot that these were local faces. And we put those on billboards across the city. And of course, had other types of outreach using this information. It was very popular and it was a wonderful campaign. We also had lots of smoke-free bar events. I'm going to give my kudos to my friend Kitty, who was right by my side through most of these, providing catering and just other support. While we put on, I looked it up the other day, close to 30 of those in a year's time prior to the ordinance vote. We did presentations to community members, healthcare lunch and learns, had tons of letters of support, emails sent in to council members from their constituents, as well as phone calls. And there was just a tremendous grassroots mobilization and work to put this campaign in high gear and let the people speak about how they feel about secondhand smoke exposure. Next slide. So on September 20th, 2011, the ordinance was introduced. It passed October 4th, 2011, and it was implemented January 1st, 2012. Unanimous vote. And we thank our sitting council members for that vote at that time, who were Chuck Fowler, Jonathan Goines, Roosevelt Johnson, Ed Larverdane, Mitzi LaSalle, Harry Silver, and Jim Ballard. And I know I said that wrong, Mitzi, I'm sorry. And we thank them for their courage and their commitment to their community to do this. Next slide. So in order to show the effects of what secondhand smoke did the first time and what it looks like after when it's a smoke-free bar, we did post-ordinance air quality monitoring. So a different crew was pulled together. We did this the first weekend after ordinance implementation. So we're talking only 5 to 7 days of having smoke-free air. This was conducted on January 6th between 4 and 11 p.m. Air pollution was measured in 12 Alexandria bars where smoking was allowed prior to January 1st. Again, the data was analyzed by Dr. Daniel Harrington, assistant professor at LSU Public Health. And if you go to the next slide, we shall see our results. As you can see, pre-ordinance, we were up here in the red on the left. In the middle is the green, which we were post-ordinance 1 week after. And then as you can also see at the blue bar, it's almost identical to outdoor air. So post-ordinance passage, there was a 97% reduction in pollution levels, and the indoor air was nearly as clean as outdoor. Before the ordinance was put into effect, employees breathed air with unacceptably high levels of pollution, levels deemed hazardous under federal air quality standards. And the fact that employees in all Alexandria workplaces can now breathe air free of harmful secondhand smoke is an accomplishment that no other city in Louisiana can match. We are very pleased to see the physical, true, measurable health results impact of this ordinance on our work. Next slide. The other pushback that, of course, happened at this time, because we were the first and people were scared to death of smoke-free air. I'm going to lose my business. My customers are going to leave. I'm not going to be able to stay open. We did a bar revenue impact study. This data was collected from 2012, which was the year that the ordinance was implemented, to 2018. And this data was given to us from Rapides Parish Sales and Use Tax Office. It's the sales tax pulled from all bars. Our Louisiana Public Institute evaluation team conducted this impact study, and the next slide will show the results from that. So in 2012, revenue was 1.7 million. In 2018, it was 3 million. In 2012, the percent of revenue generated from bars was 36%. And in 2018, the percent of revenue generated from bars was 46. And if I'm wrong, I'm sorry, but these glasses aren't getting that small, so I can't tell exactly. But it's in the 40s, and 2012 was in the 30s. So that clearly is another way to show data where this did not negatively impact jobs, the economy for those bar owners with smoke-free air in the city of Alexandria. Next slide. So I'm proud to say that Alexandria's work launched a whole series of smoke-free air across the state of Louisiana. Today, we have 30 comprehensive smoke-free ordinances across Louisiana. You can see them on the chart to your left, and 9 of those are in central Louisiana. So what Alexandria did impacted our neighboring municipalities and had a huge impact on smoke-free air for central Louisianians. And we are proud of this work, as you can tell, because we have 30 and 10 years. It's long, arduous, and challenging work. But because all of our coalition members, many of you on this call, I can't see everybody because I've got my information in front of me, but you know who you are, and I appreciate each and every one of you for the work that you have done to make this a reality, not only for Alexandria, but in central Louisiana and throughout the rest of the state. Next slide. So in order to celebrate all of these wonderful accomplishments, and in order to, give Alexandria the kudos and the congratulations that they so rightly deserve, we're having a press conference on Wednesday. So mark your calendar. We hope you can all join us. It's going to be at 11 o'clock at Hotel Bentley lobby. We do encourage mask and spreading out for good public health practice, since we still have a virus out there. And we're going to have some wonderful music prior to by DC Seals, and after by Zydeco Grammy winner Chubby Carrier. So it's going to be a very festive, exciting day. And we hope that all of you can join, because this is your work. It's not TFL's work. It's not any one specific person's work. It is a united effort of partners and community coming together to speak out and say, we would like our citizens, all of them, healthy and protected from smoke-free air. So thank you, and I'll hand it on to Claire.
Thank you, Jennifer. All right, we're going to next move on to Miss Mitzi LaSalle. She is a marketing, public relations, and communications professional with a bachelor's degree in marketing from Grambling State University. Since being a resident of Central Louisiana for almost 27 years now, Mitzi has been an anchor for the local NBC affiliate, then transitioned into medical marketing. She also served the city of Alexandria, being the first African-American woman elected to the Alexandria City Council, serving 2010 to 2014. Nonprofit fieldwork has been as a volunteer, board member, and staff with several organizations. Evergreen Life Services, Director of Donor Relations, United Way of Central Louisiana, Director of the Guide to Human Services, the American Cancer Society Relay for Life, Senior Manager, Grambling State University, Interim Director, University Communication Marketing. Mitzi's the proud mother of 4 adult children and honey to 5 grandchildren. She worships at the Word Christian Center in Alexandria, Louisiana, under the leadership of Pastors Greg and Celeste Tejada. Mitzi's also very active in her community. Her affiliations include Delta Sigma Theta Sorority, Inc., Alexandria Alumni Chapter, Mildred S. Jones Alumni Chapter of Grambling State University, board member, Sickle Cell Anemia Research Foundation, American Heart Association Louisiana Advisory Board member, at-large member of Rapides Parish Democratic Parish Executive Committee, elected July 2020, and Central Louisiana Coalition of Concerned Women Vice President, as well as Central Louisiana Democratic Women. Thank you, Mitzi, for joining us.
Awesome. Thank you, Claire, for that beautiful introduction. Great morning to everybody. This is definitely an exciting time for me to look back now 10 years ago that I was a part of Alexandria making history in a positive way, that on the healthcare front, which is not always something that policymakers get to be, especially local policymakers, too often get to be a part of. So it definitely is a time of celebration. So as Claire shared, I definitely had a role and played a part in Alexandria making this landmark decision for our community to be a healthier place, and it was definitely an honor. And what I'm also thrilled about is that even though I'm not in office on the city council anymore, I have still stayed engaged with the work of making Louisiana a safer and healthier and smoke-free environment. So I am always open all the time to going to other municipalities or sending emails to their council persons when this vote comes before them, to make sure that they understand that this truly is a part of quality of life for our individuals, and it helps them to stay healthier, have a stronger workforce, which definitely builds the economy of a community. And it's just some really important work, and to be a part of that is awesome. Next slide, please. All right, so the importance of policymakers connecting to public health experts. I am so thrilled today that so many public health experts are on this Zoom meeting. Hopefully we'll be able to view it, because it's really vital that I share with you as a former policymaker that it is really important for you to stay connected with your local policymakers, your state policymakers, and even at the federal level, because too often you guys are fighting this battle in your communities and try to keep your community partners safe and healthy with the different health topics. But it's really important for you guys to stay connected with the policymakers. And I have to commend all of the organizations that played a part in Alexandria becoming smoke-free, that they saw very much so that should be at the top of their list, because this was going to be some legislation, some ordinances that was going to have to go before the policymakers. So they knew really early on, and I commend them for getting connected with us as policymakers. So to do that, you have to engage in those one-on-one visits. They are really important for you to have all of the health information, the literature, the statistics, the educational material that you can share with your policymakers in those one-on-one meetings, that then they can go out into the public and share that information, and for them to be equipped and not just say, well, hey, I want you guys to support me in voting for this ordinance that's coming forth, that you have the educational and the materials and the statistics to back that up. Next slide. So the importance of the policymaker connecting with the community, that made a huge difference in Alexandria's council being able to vote unanimously, of which I'll be honest with you, the whole track to getting up to that day in October, it was not going to be a unanimous vote. We had some individuals on the council because of some of their constituency, of course, and also some of their, personal activities in the community that were not in complete support of this ordinance. But what made the difference is that as policymakers, we were truly equipped with the information that we needed to be able to share with our constituency, so that they would have the information that they needed to make educated decisions and be able to support us and to actually tell us what they wanted us to do. So of course there were community forums that took place. And so that's always, really important when you have big ordinances that will affect your entire community and not just certain districts. Letters of support came in, tons of phone calls came into each and every one of us, lots of emails. We connected and had to connect with some other community leaders, stakeholders. We had constituents that through those letters of support, through those emails, let us know that they wanted to be a part and that they were going to show up for that meeting where we had to make that decision. And, as a policymaker, I would not have been equipped enough if all of the agencies, tobacco-free living, all of this coalition of members that were really fighting for the city of Alexandria to really strengthen the smoke-free ordinance that the state had put into place. Next slide. So the importance of the policymaker in decisions for their community. So I go back to those one-on-one visits, those phone calls, those educational materials, the actual studies of the air quality, of the economics that were done to be able to strengthen us and for us to be able to make the right decision. So community engagement gave us confidence and covered us to be able to say yes on that Tuesday night. The equity issue. So it was really important that we focused on the equity issue for everyone. And of course, as you guys know, with any type of ordinance or legislations, you're not going to satisfy each and every person in your community, but you've got to look at what it is that's going to be beneficial to the whole. And actually for many years to come, because here we are 10 years later, celebrating and being able to know that we were able to influence, just right around us, 9 of our community partners here in the central Louisiana area and many other municipalities throughout the state. So we had to consider that this was equity for all of our citizens, that no matter where you worked, no matter where you went for fun, no matter where you shopped, that the air quality was going to be at a very healthy level. So policymakers have the responsibility to serve and to protect our constituency and those who put us, elected us to those offices. And this particular effort, we were definitely equipped with enough information that we were able to do just that, to protect the individuals, that we do serve. So the public counts on the decision makers and to guard their interests, and especially for health and safety. And I will say, because of the educational pieces, because of the billboards of the faces that we saw every day, because of the community meetings, because of the one-on-one time that we had with the healthcare industry, but also with our constituency, gave us the support to be able to vote yes. Next slide. So the day of the vote, very tense. As you guys can imagine, it was a Tuesday, as we always have our meetings on. It was tense, it was exciting, it was an emotional day. It was a day that I will say that city council chambers was as full as I probably have ever seen it in the 4 years that I did serve on the city council. The room was completely packed. There were folks out in the foyer that couldn't get in the room, but then came in the room when they needed to speak. So there was testimony from some cancer survivors that absolutely made an impact and made a difference. There were testimony from family members where there was a father that passed away from cancer that did not smoke, but the mom smoked in the house. So that's that secondhand smoke that we were talking about. A bingo hall manager came and testified that there were lung nodules that was found, and he was a non-smoker, but as you can imagine, back then in a bingo hall full of individuals that smoked, and so that secondhand smoke definitely affected that individual. So not only was it a tense day, I want to commend the Alexandria city attorneys and also the attorneys that were advocates for this effort, because even that day, as we were having discussion in the meeting, there was some terminology that some of the council wanted to change, and we took a little brief recess, and those attorneys went out and hashed things out and then brought it back to us just the way that we all wanted it to be and what was kind of best for everyone. And so that was commendable for sure. And then as we were going around, and it definitely was a roll call vote, okay, because we needed to know who was, voting and how they were going to vote and why. We actually all had family members or friends that had been affected by secondhand smoke. And I will be honest with you guys, even up until that point, we were not sure if it was going to be a unanimous vote or not, but it was. And that was a truly good day here for the city of Alexandria. So next slide. Okay, so the experience, and I think I kind of started off with that, guys, but it is here now in this last slide that, this experience, that was truly one of the highlights of my 4-year term there with the city of Alexandria. And it has absolutely leaked on into my life after the council, because I definitely have stayed involved. And up until this day, and I want to say maybe last year is when, or maybe year before, the ordinance went before Shreveport City Council, but there was a point in time where they were reconsidering going back and then voting no. And as a former council member, I went to work and sent emails to all of those council members out there and encouraged them to know, let's keep this vote exactly the way that you guys passed it before, because we don't want any loopholes. We don't want to have individuals in your community that, have to make a choice and be like, yes, I have to earn a living, but then I have to go into this gaming facility, that is full of secondhand smoke and is not safe for me. And, not only, those that work in gaming industries, but in bars or any type of in the entertainment industry. So the work continues. We are still fighting, and definitely proud to say that there were 29 other municipalities that have adopted smoke-free ordinances for their communities. And so it's definitely moving around the state, and we are going to keep working. So proud of Alexandria. This year, next Wednesday, we're celebrating 10 years of this awesome accomplishment, and all of you guys that are live right now in this Zoom meeting, but all of you that will view it. Thank you. thank you for being so supportive of your community and making sure that the health and welfare of yourself and your neighbors is first and foremost. So I think that that is it for me. Next slide. Let's see what we got. Questions and answers. All right, questions or comments. Thank you guys so much for tuning in today.
Thank you, Mitzi. That was wonderful. So we will have this Q&A section. I'm kind of looking back at the chat. Let's see, Dr. Holcomb says, Ashley, excellent presentation and congratulations to the Rapides Foundation for their important work. Let's see, I'm looking for questions in particular. Was everyone able to see the slides? I see that some people may have had trouble. Okay, good deal. All right. Let's see. Miranda Morley is asking, what were the major hurdles that you faced in getting approval and support?
You want me to take that?
Sure.
Team? Okay. Gosh, the major hurdles, there was, of course, the economic. I mentioned that in the commentary that I did through my presentation. Lots of it was fear. It's a lot of fear-based concerns, especially since Alexandria was the very first one. Now that we have data, it's a little bit easier, but you will still hear that as a major pushback in every single ordinance. I'm going to lose customers. I'm going to have to close down. My business is going to shrink. So economic is probably the number one. And of course, that resonates very strongly with policymakers, because that's a number one issue that they always have to keep in mind in protecting the community is their funding. The health issue, everybody pretty much realizes that, you know, smoking is detrimental to the health of an individual who smokes and the people, the secondhand smoke that goes to the people who are around them. So there's not a lot of pushback on that. We do get a lot of civil liberties issues. My business, stay out of it, you know, I don't want the government intruding on my life and telling me how I need to conduct my business. So I would say that those are the two primary pushbacks that we get, not only that we had in Alexandria, but across all of the other ordinance work that is done throughout the state and the United States. Those are pretty typical concerns from the public, unfounded, but very loud.
Okay.
I'd like to add if I may. So when you talk about an ordinance like this within a municipality, no matter what size it is, it ends up coming down to the policymakers. So although Alexandria has a population of, you know, even at that time, if I remember correctly, a little bit over 50,000 individuals, that the decision was left up to 7 individuals. And so that definitely can be it's a concern, you know, it's a concern, and it's definitely a hurdle that has to be crossed, you know, with anyone in the healthcare industry or economic industry, that you want some type of policy to be put in place. So I will say that too is absolutely a concern for you know, those that are courting policymakers to get their support for any type of issue. So any of you moving forward, that you have something that does have to go before your policymakers, definitely get with this coalition, get with Jennifer and try to get a blueprint, because they did it excellently with engaging us as policymakers, and kind of encouraging, strongly encouraging us to also share the information that they were sharing with us, and supported us in that. They came to the community meetings with us for us to be able to share the information with our constituency. So kind of having that blueprint that they used, I know will be helpful moving forward.
Wonderful. Thank you, Mitzi. Did anyone else have any questions they'd like to put in the chat, or you're welcome to raise your hand as well. Let's see, Kitty, can you help me keep an eye on hand raising? Okay. All right, well, I do want to make mention that next month we will have another presentation. It'll be on February 18th. It's on self-care. There will be yoga and mindfulness. And of course, please remember that all of our videos are recorded and they will be available on our #HelpInSendLaw YouTube channel very shortly. And I will also send that link out to that channel as soon as the video is uploaded. So let's see. Everyone's just saying great presentations. Thank you for the information. Did anyone else have anything they needed to add? Jennifer, any last words?
I put them in the chat. Thanks everyone for your support. It just, like I said, this is a coalition effort. It's a community of effort. And I love that last slide. It's one of my very favorite, but when we put our minds to it, we can affect change. And we never need to forget that, because that's how, there we go. I couldn't have pulled that out of my head, but basically, this is it. This is the premise of the work. And so thanks to everybody.
Okay, well, with that, if there are no more questions and no one to add, we will go ahead and adjourn for the day. And thank you all for, we're so glad you were able to make it on, and thank you to all of our wonderful community partners who helped make this possible.
Just a reminder too, that if you did not get to see the first part of the presentation, you'll be able to view that on our YouTube channel, #HelpInSendLaw.
Right, and you can also share those videos too, whether it's through your social media or whatever, that link will be available for you to share it widely. All right, everyone, have a great weekend.
Y'all too, thanks.
Great weekend,
Thank you very
everybody.
much.
Bye-bye now.
Bye.
Thank you for facilitating, Claire.
No problem.
Sorry, I didn't have time to text that to you.
Okay. Okay. So I have to end the recording.